sick and tired of the high costs and inefficiency plaguing our U.S. healthcare system? Do you feel like you're navigating a maze when dealing with insurance companies, only to end up paying a fortune for basic medical services? Then this Broken Healthcare podcast is for you. So get ready to take control of your healthcare. Here's your host, Ray Kober.
And we're live, ladies and gentlemen. Welcome to Broken Healthcare. My name is Ray Kober. I am your host, and I am delighted to have with us today Gary Becker. Welcome to the big show, Gary.
Nice to spend time with you, Ray.
Oh, always, my man. So Gary and I go way back. I joined a mastermind that Gary had already been a part of. And if you're a broker tuning in, the mastermind is Next Gen, and it's founded by Nelson Griswold and Scott Cantrell. And Gary had been there for a while. He was one of the founding members, I think, right, Gary? Yeah, one of the founding members. And Gary, to this day, if you see him at one of these get-togethers, he is always in the front row. He's got his little computer or iPad or notepad. He's always taking notes and engaged. And if I'm being completely honest, he's one of the first people that really opened my eyes up to what's going on in the healthcare system and what could be done about it. And so I do owe you a debt of gratitude for that, Gary. I appreciate you taking me under your wing and showing me the ropes. And man, there was a lot to learn. It was like baptism by fire. But you were awesome. And so I guess what I'd like to know is, what was your path like? If you take us back, no one starts out saying they want to be in the insurance industry. I'm sure it's no different for you. How did you find the mastermind group? What led you to that? Tell us about the early years of Gary Becker.
Well, I'll start. I graduated college in 1985.
Okay.
I had no idea what I wanted to do. One of my father's friends was in the insurance business. He was a policy peddler for the Actionable Life, and he was doing very well. And I was drawn to it because I can control my own schedule. I was an avid basketball player. I'd like to be on the court, first one there, last one to leave kind of guy, play golf as much as I'd like. And so I'd like having the freedom of being my own boss. I'd like the freedom of making unlimited amounts of money. Yeah, there was no ceiling. So I started Actionable Life, and then I shortly realized that I didn't want to start back at zero every year. And I liked the idea of having recurring income. So I gravitated towards employee benefits, selling fully insured products, eventually started getting into the self-funded marketplace.
Huh. So you were a bit of an athlete. Were you any good at the basketball game? And what's your handicap?
Well, my handicap ranges, I'm in the single digit, not as low as I'd like. I had a high delta factor. I probably thought I was a little bit better than I was, but I could play.
Okay.
I was proud of my game. So really, from there, so what happened was I wanted to be a very successful guy. I felt like I was working in a silo. LinkedIn wasn't even that popular. And I met Nelson Griswold, and he introduced to me the idea of creating this mastermind where like-minded folks from different parts of the country can get together once a quarter, collaborate, share ideas, and there's a group think experience that occurs. And just by putting a bunch of folks together, it allows you to learn and grow in a way that you couldn't if you just worked with a coach individually. And I joined the mastermind, not really knowing what I was getting into. And at the time, it was pretty expensive for me. And it worked. I met some great people, and I became a disruptor. And I'll mention, prior to then, I got into the captive space and I created the first benefit captive. I liked the idea of banding together a bunch of groups that were fully insured and give them the opportunity to self-fund their health plan so they could do better. Transparency, control, risk management. And I brought that to the mastermind, being one of the first guys to be in a captive program. That's how it started.
Yeah. I love the idea. And that's what drew me to the mastermind as well. The first time I think I came across that term was reading Think and Grow Rich by Napoleon Hill. And the whole idea of no one person as good as the collective minds of many just made perfect sense to me. And so the idea of a mastermind group focused on insurance, and let's face it, the insurance business is a great business, but there's nothing easy about it, particularly when you're ramping up and you're trying to make a name for yourself, you're trying to grow a business, a lot of obstacles and bumps and bruises along the way. And so I looked at it, and I'm a career sales professional. I've been selling since I'm a teenager. And at the end of the day, you look at your business opportunity and you say, all right, what's my value proposition? And when you realize that if you're a little guy, I don't care, little could be you're a one-man shop, little could be you have a 3 to a 5-man team, little can mean you have a 50-man team. It's little when you're going up against the likes of these giant multi-billion-dollar brokerages that are essentially fighting for the same piece of the pie that you are, right? And so it's what's your value proposition? And so interesting to me, though, when I joined the mastermind, it was 2018. You go back a few more years, but at that point, you're saying it was still like a costly expense for you to make that investment. What did your business look like back then, and how did it transform since then?
So I owned and continue to own an agency called Becker Benefit Group, and I was a small shop. I got into that captive space, so I was transitioning a lot of these mid-size employers, smaller and mid-size employers, from fully insured to self-insurance. And as I became more active in the self-funded space, particularly with this new captive idea, I wanted my clients to do well. And I looked at the risk management strategies that were out there that were being promoted, and it was wellness. And what I've learned is these wellness programs, they don't move the needle. It doesn't help an employer save money. So that's when I started looking for other opportunities to help employers control healthcare spend. At the time, prescription spend may have been 25% of the overall healthcare cost, and learn about the opportunity to source medications internationally. Here in the United States, name brand and specialty meds, which represent about 80% of the spend, cost 2 to 10 times more than in Canada, United Kingdom, Australia, New Zealand, these tier 1 English-speaking countries that folks are comfortable sourcing meds from. So when I learned about this risk management opportunity to make available to my clients, I started discussing with the employees that there was an opportunity to get a $0 copay if they use this international service, and everybody got real excited about it. At the end of the day, after hearing about the vision and the dental and the retirement plans, nobody enrolled. Got great feedback at the time. So that was my aha moment that I needed to create an engagement company, because I believe that people like getting things for free, especially with the medication non-adherence issues that we have in our country. And I believe that employers would prefer to spend less on medications than more. And ScriptSourcing was born.
So tell us a little bit about that. How exactly does ScriptSourcing work, and how did you make the leap from no one was interested to now today you have a thriving business?
So I'll go back 8.5 years when ScriptSourcing was pretty new. I had a hard time writing one group in a month. And maybe if I got lucky, it was a 50-man group, and we wouldn't even source any medications or many medications. We wouldn't make much money, if any. Luckily, I met more and more benefit consultants, one of them being Spencer Allen, who we talked about earlier.
Yeah.
And all of a sudden, I had my first 1,000-man group. And we started transitioning groups, or not only to ScriptSourcing so we can source meds internationally and some of the other solutions we made available, but we changed them from these big 3 PBMs that everybody thought were the best PBMs that are actually gouging employers, to a fiduciary type PBM who really clinically and financially manage spend. So to make a long story short, we today write over a group a day. It's changed so much. We have thousands of clients that we work with. We're growing. We have currently about 60 employees, and we're still hiring. It's really, we're helping meet the demands of the marketplace. Cost control is the number one concern for employers. We're in the business of helping people. We're helping employees every day. They're struggling. 70% of Americans cannot afford an unexpected $1,000 medical bill, probably unexpected any kind of bill. And we're helping these employers save money. And when that occurs, premiums aren't as high for their employees. They have a competitive advantage. We've saved many employers well over $1 million.
$1 million?
Yes.
On what kind of a total spend?
Well, when I made that comment, we've saved some employers over $1 million, maybe over 3 or 4 years. Some employers $1 million per year.
Wow.
So I do know that one of our clients, a municipality, 1,200 employees, in their first year, we saved them $1 million.
Wow.
And that was a big deal, and we used that to market to other employers.
The thing that's a mind blower to me, Gary, being an entrepreneur and having started a number of businesses, this is real money. It's bottom line dollars that you're saving an organization. And 7 figures, how could you repurpose that? How could you reinvest that money into your organization and into your people? And to this day, it blows my mind when I meet with business leaders that they don't see it that way. I just don't understand. It's either a reluctance because it's the unknown to them. They're attached to what they know. And obviously they think they're being sold a dream and that you can't possibly deliver, or their priorities lie elsewhere. And I get that, right? Everybody is busy. And I think the thing that I have to retrain myself into learning constantly is our business. And we're in it and we eat it, sleep it, breathe it. And when we meet a prospect who is coming from a fully insured arena, or maybe coming from a level funded environment where they know a few things, but they pay other people for that, you have to always be educating them so that they understand how exactly you can deliver. So share with us, give us a real world example of how you might save how one employee savings might impact a plan.
Well, I'll start by sharing what I've learned in business and in life. There are early adopters, there are eventual adopters, and there are non-adopters.
Right.
And in our industry, I think everyone knows that there are conflicts of interest. And there are benefit consultants out there where their agencies make more money the more their clients spend. It's sickening. It's the way it is. And the employers believe these benefit consultants. Yeah. But with technology and transparency, they will soon see that maybe their interests aren't properly aligned. So I'll give you an example. There's a medication called Tecfidera. It's for multiple sclerosis, and I hope I'm pronouncing it right. I've been calling it Tecfidera for years. It might be Tecfidera. I'm not a pharmacist, I'm a risk manager, but I'm pretty sure it's Tecfidera.
Yep.
And here in the United States today, it costs $100,000 a year, which we can source the exact same medication, manufactured in the exact same facility for less than half. I think it's $40,000.
Wow.
So when we talk about that with employers, $60,000 savings for one medication for one member sourced internationally, that's a big deal. And then if the company's big enough and there's some other specialty meds or name brand meds that are being taken, the savings can pile up.
Yeah, it doesn't take much. And I've had numerous, more than I can count, conversations with CFOs primarily who they tell me how they're getting rebates back, and the rebates, they're all set because the rebates that they're getting back are enormous. What would you say to that?
I think the marketplace is starting to learn that chasing rebates is the worst strategy. They'll never save as much as some of the solutions that we make available. So we've talked about international sourcing where we're saving 50 to 75 cents on the dollar. Sometimes we're able to source medications at no cost at all through assistance programs. We've got 340B programs. We've got other domestic sourcing solutions. But chasing a rebate is what the big box agencies would like their clients to think is the best strategy.
How hard is it to figure out if you can save a plan? Because I would imagine there's no such thing as being able to help everyone. If a client comes to you and, I don't know, maybe they have some of these strategies already figured out, is there some type of an analysis that you do that will determine whether or not you can benefit them?
Sure. So we've over time become a technology company.
Hmm.
So if we're provided data, that's prescription claims data, we're able to run it through our engine and make available the best solution and the savings for any medication that we're able to source. So some medications can be sourced internationally and through assistance and through 340B. Some medications may be only through one or two of those solutions. But we're able to show an employer what the savings potential is. When we do a lot of international sourcing of meds, we think it makes sense to make it a voluntary choice, not to make someone source internationally. We don't get 100% adoption, but we get high adoption. It really depends on the plan design and the employer and how meaningful it is to save 50, 100, a couple $100 a month. For some plan members, what we've been told is, I was told personally, Gary, this is the difference between a good Christmas and a great Christmas for my family. The fact that we can get these medications for free.
Yeah, that's amazing. That does your heart good. I've experienced that as well, where we've been able to have an employee go on a program that's federally subsidized, and ultimately they're spending thousands of dollars before, and after they're out of pocket is literally zero, and they have tears in their eyes because it's real meaningful dollars for them. And I think at the end of the day, that's a point that often doesn't get emphasized enough. What we do as benefits advisors and what you do in ScriptSourcing as a solution, yes, it's money saving, but it's more than just the dollars and cents. It's elevating the quality of care, and it's literally changing people's lives. And that's really where I get excited. As much as I love saving an employer $1.5 million, $2 million, which we've done, it's so much more gratifying when you could look at a single mom that is trying to just make ends meet to put food on the table for her kids. And all of a sudden you save a few $100s, you save a few $1,000s, and it's powerful. It's really powerful stuff, man.
So my agency, Becker Benefit Group, we were a smaller agency. And when I built ScriptSourcing, it was with a benefit consultant in mind, because I've been a benefit consultant my whole life. And it was because how do you compete against these larger multi-billion-dollar agencies? Well, I wanted to create a solution that allowed brokers to have more insights, provide savings, have better conversations, and even get paid money for their efforts, which brokers are certainly entitled to because they help facilitate the whole transaction. So we've been able to help a lot of these smaller agencies win business that they may not have otherwise won. We've been able to help these smaller agencies, now mid-size. We're working with the largest agencies now, but provide quantifiable and measurable savings and value to help justify what they're getting paid. Brokers can get paid a lot of money on these accounts. And when you can show an employer, we just introduced a solution that saved you many hundreds of thousands of dollars, they feel good about what you're getting paid. They're not looking to replace you.
This episode of Broken Healthcare Podcast is brought to you by Benefixa Healthcare Consultants. Visit benefixa.com to learn what's possible. Reduce the cost of healthcare for your organization, deliver better outcomes for your people, and yes, design health plans that give your people a path to $0 out-of-pocket costs for healthcare. Visit benefixa.com today. Let's not forget that it takes an awful lot of work to be a next-gen advisor, a Health Rosetta advisor. There's so much more labor intensive. The work is so much more labor intensive than a plug and play broker that simply spreadsheets a bunch of carriers, comes back, drops it in front of employees. Maybe it's a nice, beautiful PowerPoint, and they're in and out and they're one and done. To really be thoughtful and considerate and to think, all right, I'm going to put myself on the executive team and I'm going to look at benefits through my lens, knowing what I know, and bring everything that I know. I want to leverage that to the benefit of an employer. It's so much more than just throwing numbers onto a spreadsheet. And your solution is part of that process. But what really strikes me about your solution is you can't argue with math. And so if they're giving you hard data and they're showing you what drugs they know they're using today, and you know what the cost, what they're paying now, and you do a before and after comparison, that's simple math, right? Here's where you are now, here's where you can be, and it is what it is, right?
They say people lie, numbers don't. But earlier, like, it's a lot easier for a benefit consultant just to keep an employer fully insured.
Yeah.
They make more money. They can set it and forget it. Here's your renewal, and maybe there's a little gulf between renewals, but there isn't a lot of work when you work with these fully insured carriers. You make less money, and there's so much more work involved when you're making available a partially self-funded health plan. But it feels good to make available a health plan that has cost containment, cost control levers, and see an employer just fare better.
Yeah. Yeah. And I know that when I first joined the mastermind, you were very generous with sharing case studies for clients where you were their broker and you did a 5-year timeline of what their cost savings were. Can you share a hypothetical with us of over a 5-year span on the benefit side,
Sure.
not the ScriptSourcing side, what you've been able to do for some of your clients?
So at the time, I probably shared a bunch of my clients. What I used to do is show the per employee per year spend every single year and show whether it's trending up or trending down. And for my clients, because we introduced risk management, I shared, I have clients that never spent more money over 10 years, never spent more money than before I got involved. Wow. 13 years of less spend. The client that had the longest run of less spend this past year just finally breached what they had spent back in 2010.
Wow.
Okay. So, this group may have been like 60 employees that saved many millions of dollars compared to getting healthcare inflation increases. But I think it's important to measure your spend. And when I talk about per employee per year spend, is really easy. Whether you're fully insured or self-funded, just divide the total spend by the total number of employees each year. Just have that calculation, that benchmark. Just see how you're doing relative to prior years. Your spend when you're self-funded will vacillate, but hopefully, and when you use many of these cost containment solutions, you'll see how much money, that you saved as a result of that. I think it's important discussion points, particularly when it's renewal time.
No, I agree. Those are words of wisdom. I always tell my prospective clients, you got to know your numbers, right? If you're a CFO, if you're in leadership, if you're running an organization and you're spending this much money, you need to have a baseline. You need to know, hey, what am I spending and what is something that we can measure against? And PEPY is the answer to that question. And as you said, it's simple math. What's our all-in spend just on healthcare, not dental, not life, not ancillary benefits, just my healthcare spend, divided by the number of employees you have on plan, because that's a vacillating number as well. It's going to go up and down. But the total spend by the total number of average participants in a year will give you the PEPY, and that's something that you can measure against. And to say that you had a client that 13 years of not increasing is unheard of. So look, let's face it, that's also a product of probably a group that hasn't had a lot of sickness, because no matter how good an advisor you are, we're not magicians, we're not wizards. We can't prevent someone from being diagnosed with cancer. We can't stop someone from being diagnosed with multiple sclerosis. Those things are going to happen in a plan, and even the best plans are going to have years where they blow up. But in a case of one that didn't have that happen for 12, 13 years, that's an amazing run. But I can assure you one thing, if that cancer diagnosis did pop up, if MS did pop up, now you're in a better position to manage that risk and to source treatment, medication, etc. You have flexibility, which is going to lead to higher quality outcomes and lower costs that you just would not have in a fully insured plan. Would you agree with that?
I would. And also just thinking about the last thing a benefit consultant wants to do is present a double digit, particularly a high double digit renewal, to their client. But when a broker can show their client that, hey, look at the last 10 years of performance. You've saved $6 million or whatever that number may be. You're supposed to have a bad year every 5 or 6 years. It's taken you 8 or 9 years. We're on the right path. You could change back to fully insured. Maybe some advisors may even, promote that, but you're doing the right thing by being self-funded. And just by being able to share the numbers and tell the story, retell the story, because there's change in management. We have a lot of clients that have remained self-funded despite having a double-digit renewal.
Yeah, well, but again, it gets back to what you can do about lightning when it strikes, right? You have more control. I really hate the term self-funded because it sounds more risky. Just the term. If I'm a CFO and I'm a conservative CFO, and most are, if I say, do you want the insurance company to take care of this, or would you rather go self-funded? They're like, hell no. Let the insurance company take care of it. Until they really dive in and educate themselves and learn and understand that in our space, self-funding really means flexibility and it means options. There is risk involved, financial risk, but you carry that risk in a fully insured plan as well. You just need to partner with the right folks that are going to bring your attention to what the risk is, full disclosure, know the good, the bad, and the ugly. And then when you have all the information, you can then at that point make an informed decision. So Gary, how do folks engage you? I'm hearing that you work with brokers, including the big guys. Is that primarily how folks are finding ScriptSourcing, or is it certain TPA relationships that you have? What is the best way to engage your services as a wholesaler, basically, on the ScriptSourcing side of the business? How do folks find you? What's the path that gets me to you?
I'll start by sharing the mistake that I made early on. I thought I had such a great solution. I could market directly to employers, win business that way. And as it turns out, every employer wants the blessing of their benefit consultant. No benefit consultant
Never heard that
some
before.
other party to disintermediate them and make suggestions.
Right.
So we quickly learned that we need to work through benefit consultants. So to answer your question, we work with many hundreds of benefit consultants throughout the country. We work with TPAs that prefer. There are TPAs and PBMs who are interested in having their clients pay the lowest possible net cost for prescriptions, for care. And we work with those folks who are actually embedded in some level funded health plans because they want to have a high performing health plan and good renewals for their clients. But in terms of how to find us, we do have a sales team. We have a social media presence. I feel like many folks in our industry know who we are, know where to find us, but we're not going to wait for our phone to ring. We are contacting via email, via phone, via conference. We're in touch with the folks that are active in the self-funded space.
Got it. And so it's scriptsourcing.com if people wanted to shoot an email, or how would they engage you guys?
www.scriptsourcing.com.
Might not even need the www anymore. Scriptsourcing.com. Excellent. And yeah, I know Gary for years, and what I can tell you about Gary is that he's going to shoot you straight. He is a wealth of knowledge. As he said, he has run a brokerage for many, many years, and ScriptSourcing was born out of that. And having that type of insight and type of knowledge makes him more than just a vendor. It really makes him an asset on your team, because I'm sure, Gary, that part of your business and your team's business is supporting your clients and joining a call with an employer to discuss specifically how your solution will contribute to the overall savings. And that, I'm sure, has led to many converted sales for your broker clients.
It has. And earlier in our conversation, I talked about us being in the business of helping people and reflecting the past 8 or 9 years since we've been in business. I'm so happy about the relationships that we have now with so many benefit consultants and the livelihoods our benefit consultants have been able to win a lot of business, especially those that were early adopters of our solutions. They were able to win clients. We've been able to help so many plan members. Many thousands of plan members are getting their meds at no cost, and they're happier, healthier. And the employers that we do business with, I'm a competitive guy. I mentioned I like sports.
Yep.
I want my clients to have a competitive advantage and win.
Yeah.
And when my clients are spending much less on healthcare than they otherwise would have, I feel like they are getting that competitive advantage.
For sure.
And I'll also mention that we're not a one-trick pony. So over time, we have continued to innovate, and we have and continue to bring new solutions to the marketplace that we think will provide value to plan members, to employers, savings. So this is the first couple chapters of ScriptSourcing, and we're excited about our future as well.
Can you give me an example? Give me an example of another service that you offer.
Well, one is called debt dismissal. So it's a hospital debt relief service. Most folks don't know that hospitals provide patient assistance programs. Nonprofit hospitals are required to provide patient assistance programs. Well over 50% of Americans qualify for patient assistance. So they go to a hospital, they're going to have a baby, the happiest time of their life, and then they have a deductible on their health plan, often several thousands of dollars that they can't afford. And they don't know that there's an opportunity to apply for patient assistance and have that erased, reduced or erased, but typically erased. So we have a technology that allows someone in under 8 minutes to apply for hospital patient assistance for any hospital in the country. So that's one of our solutions that we're excited to be able to provide to folks.
Is that available now, or is that something that you're still in beta?
No, it's available. We're rolling out a new solution, or really just technology, called the hidden paycheck. It's something that we used to make available. It always seemed to be expensive, but what a hidden paycheck is, you may pay an employee $100,000, but what the employee doesn't realize is between their health insurance and vision and 401k, like their compensation package might be worth $130,000. So there's a simple way for employers at a very low cost, we're giving it away to our ScriptSourcing clients, to make available information about their total compensation so they can better attract and retain employees, which is the name of the game.
Awesome.
And there's more.
Do you want to keep going?
We have a solution that we've been making available for a year called Avert AI, and it's predictive modeling. So, as a CFO, it's nice to know, based on decades of information, procedure codes, prescription claims, what the predicted spend will be over the next 12 months. So you can better budget. So we have that.
Very interesting.
We have solutions for high claimants that have been very popular. We call it We Care Connect.
And so are these services that are add-ons, or they're value adds that ScriptSourcing clients enjoy, or a combo of both?
It's a combo of both.
Combo of both. At the baseline, Gary, what I'm hearing is everything that you do is really aimed at reducing costs for employees, reducing costs for members, and with that savings, hopefully improving their quality of life. So, and providing benefit consultants value. That is something to share with their clients that'll put them in a better position than their competitors. If they have a hospital debt relief solution, that could be really meaningful to an employer with low-paid employees who can't afford $2,000-$3,000 for a baby or an unexpected surgery. No doubt. All right, my friend, let's leave it there. I absolutely appreciate having you on. Hopefully we'll do it again. But until next time, folks, stay safe and be well. Peace.
Thanks, Ray.
So that's it for today's episode of Broken Healthcare. Head on over to iTunes or wherever you listen and subscribe to the show. And join us on the next episode.